Thank you very much, Michelle and Hailey and hosts here who have done such a good job of bringing us together 800 plus strong. I want to talk very rapidly this evening because I want to cover a lot in a short time. I am very pleased to be here to be able to present at least a snippet of the SAMS study, which is just about done, the Sub-Saharan African Medical School study. But I do want to link it to the global workforce situation, which is why the title Ties That Bind, in the sense that we are linked together in many ways on the academic and particularly in regard to the education of physicians and the ongoing deployment of physicians. The SAMS study is funded, as you've heard, generously by the Bill and Melinda Gates Foundation. 2 years running. We're about at the end of the 2 years at this point, based at the George Washington University, but with a very active and central African Advisory Committee of 16 African medical educators and policy leaders. Principal arms of the study were two. The basic question asked by many people, and particularly in regard to Gates's approach to this, was, well, if one was to fund medical education in Africa, where would one begin? What principles, what areas, what schools, what educational interventions? And as you know, I suspect in general, the educational literature is very meager, and in many countries the educational enterprise is quite limited, localized. There's not a continental organization or journals or a discussion, ongoing conversation of any major degree about medical education. So it was really an effort to landscape what was out there. So the two arms of the effort, one was essentially a sample survey, site visits of teams of 2 African educators and 2 GW faculty to 10 representative schools from around the continent, and then an attempted survey of all medical schools in sub-Saharan Africa. We were told best wisdom a couple of years ago was 103 schools. To give you a sense of the accuracy of our database, we've now found 164 schools. So a wide margin to be improved on in terms of data of all sorts, even at the base of schools. Surveying in Africa was thought to be a very difficult undertaking. We've had a 72% response rate, quite gratified by that. This is the essential SAMS team, the 15, 16 African medical educators. Francis Amaswa in the middle was the essential leader of the African Advisory Committee and intermixed with GW team. The schools are here around the continent. We cut off the Mediterranean rim as not sub-Saharan Africa, but everything below that. We're weak on Central Africa, both linguistic problems and problems of countries in which it was hard to make and sustain contacts, the DRC in particular. But pretty good. 2 Francophone schools, a Lusophone school, Arabic-speaking school, and 6 Anglophone schools. And these were the teams assembled for each of the site visits. They spent a week on site, including visits to the Ministries of Health, Education, and the Medical Council of each of the countries to get the rest of the story as it were, in addition to their time on campus. I'm going to go very quickly through some of the findings from the survey. We have a great mass of material, have a manuscript in process at Lancet, and we'll publish a full report later this fall. The history of schools, as you see here, not surprisingly a spike at the time of independence, but somewhat surprisingly a spike in the last 2 decades, big spikes, and this far before the attention to health workforce in the middle of this last decade became much more active. Another very important point, as you'll see from the non-blue schools, those are varieties of private schools. None before 1990. Now, a full 20% of schools in sub-Saharan Africa are private, a mixture of faith-based and secular. The secular, both not-profit and for-profit. Very controversial issue among African educators. In terms of tuition costs, the vast majority are below $1,000 per year, although a long tail going in the other direction, with the privates being far more represented there. And as you can see, both the public schools get the vast majority from government and the privates from tuition. If you look at the location of graduates of the schools 5 years later, you'll see a variety of expressions of practice, but the largest category is out of the country, a category also of migrated within the country to other non-governmental organizations. And if you look at the loss of teaching staff over time, once again, out-of-country migration is the leading, and also the NGO category as well. Major problems in terms of, obviously, people who are very employable with high skill sets are easily moved, and not only developing faculty, but stabilizing faculty is an important element of the work going forward. Very modest involvement in grant-supported research. As you'll see, the majority of schools, or less than 10% of the faculty, are engaged in grant-supported research. We found on the qualitative side a great deal of support at schools, not surprisingly, for research as a faculty development tool, quite beyond the new knowledge, obviously attendant to the research. But most schools felt that they could hang on to faculty and do better if they had a portfolio of research activities, easily said, often hard to come by. The partnerships of the schools studied, the majority, the largest number, were in Europe. We had pretty good response from the Francophone schools too, and of course their connections were largely to France and Belgium, the Lusophone schools to Portugal, but good representation of North America as well. The advisory board, with the leadership of the effort, worked hard on a set of recommendations beyond the findings, and I'm going to go through these quickly, just highlighting a few. There are no epiphanies in here. On the other hand, there are some important observations and validation of issues people have thought to be the case, but now with a much better evidentiary base. The two top issues, which are faculty and infrastructure, are inescapably problems everywhere. Faculty in not a school we visited, including Ibadan, probably the most mature school certainly in Western Africa, faculty issues of both development, numbers, retention were key. Infrastructure issues ran the gamut, from dorms to bandwidth and everything in between. Many schools in quite decrepit shape, so there are many initiatives one could consider, particularly going to the private sector or philanthropy. Someone could be the Johnny Appleseed of, say, computers in African medical schools. Bandwidth is an infrastructure problem beyond the schools, but will improve in the next 5 years. We're told there are major trunks going down either coast, and I think that will improve. But the actual hardware is something, just an example. Someone could be the dorm, the essential dorm intervener and build dorms, etc. Research, as I mentioned, is critical not only for generating new knowledge, knowledge pertinent to the burden of diseases in specific countries, but also for faculty development. Graduate medical education is not a luxury. Many people say, well, gee, we probably shouldn't be investing in medical education at all, but if we are, we certainly shouldn't worry about specialists. Keeping doctors in country and developing a sustainable and appropriate panoply of medical expertise is very important, and ambitious physicians, regardless of country, tend to leave to get training, and of course many don't return. So building, as certain countries have rather aggressively, basic postgraduate education plans and building them out is very important, both for faculty, for developing teachers, and for stability in the system as a whole. And accreditation and certification of institutions and individuals, a very spotty and irregular, very important area for initiatives. This is Mali, 2,000 students, first-year students in this room. I show this because if anyone questions the ambition and the grittiness of African medical students, this is the answer to it. They're there, they want to study, they want to learn. They are subjected to the numerous clauses system where at the end of the first year, 350 will remain, the rest will be dismissed based on academic performance. Not a great system, but a really impressive statement of commitment. Up in the back there, you could not see or hear, but they were taking notes anyway. Computers kind of clunky in many places. This is Mozambique. The doctor in the middle is in her second year. She's out of the first class at the Catholic University of Mozambique in Beira. The two students are clinical students at the school. She's doing her national service on the pediatric ward, and perforce she becomes the pediatric professor. It's see one, do one, teach one, not an optimal system, but underway.